Dr. Aboagye, I would want to come back to you and talk about your event yesterday, the public engagement on the rollout of the COVID vaccines. Maybe if you can, in 1 minute or two, just give us a brief of what the vaccination plan is. Because I remember you spoke about, there wasn't timelines mentioned, but you spoke about the segmented distribution.
Yeah.
You spoke about the justification for vaccine, which sought to dispel fears around. So maybe give us a summary of that.
Well, thank you very much. Yesterday's event was an outdooring or the launch of our move to the next phase of the fight against COVID, which is the vaccination.
Okay.
We've used protection protocols, we use restrictions. They are going to stay, but we are now going to get to a stage where we are going to get our own bodies to be able to fight the virus better. Instead of just getting sick before you are able to fight it.
Okay.
So what we have done is we have a segmented approach to deploying the vaccines. We are not going to give you timelines here, but we are working on the March dates that we're giving you that we need to go through some training. We need to ensure that the vaccines have arrived.
Okay.
Because of the global scramble for vaccines, you are not going to have 40 million vials in your country in a day. You're going to have them in trickles, just as it's happening in other developed countries. So we are mapping strategies which include static.
Okay.
When I say static, for example, there's a clinic that everybody knows that this is where they are getting vaccination. People who are within that segment for the period will go and have their vaccination.
For instance, hospitals.
Yes, those who will have to do an outreach to reach because they are where they are, they cannot move. We'll move to them. Those on islands where you cannot go and come every day, a team might move there, stay there, and vaccinate them before they come. So these are some of the core approaches that is going to be used.
Okay.
And
the segmented groups.
the segmented group, the criteria, broad criteria is that people who need to be available to treat or respond to the vaccine, the virus, that's the health workers, is on the top criteria. The state must run. Who are the key actors who must be available? At example, if you are going to get a loan to go and buy vaccines and Parliament is closed, you can't.
I see.
You can't get approval. So we have the group that also, because of essential services that have to keep the state running, will be then, and
they will be high risk.
Yes. They are high risk. We have policemen who are chasing people who are not wearing masks. So,
Yeah.
So that group is another cluster. And we also have the vulnerable group who, like those who have comorbidities like hypertension, diabetes, and other people, those of a certain age bracket, teachers who are now, schools have reopened and they are having to teach and all those things.
Okay.
So that's how the criteria, the broad criteria is in terms of, so out of that you're going to have the health workers, essential services, vulnerable groups, and then the general public.
Okay.
So that's how it's going to. But this doesn't mean that you're going to go in line. If for some reason we have 20 million vials of vaccine today, a lot of these clusters will go on at the same time. Okay. But in the event that you don't have it, then that is how you're going to do. You are segmenting the population. It's not because someone is more important than the other, but we need to do it in a way. And also, we are going to apply the geographical model as well. Okay. What it means is that if 60% of all the cases are in Accra, and you want to contain it, then you need to focus on Accra and Kumasi, where the significant number of, and this is where the breeding grounds for the virus. If you find them in Wa or somebody who has moved from Accra or somewhere to the place. So
there's no special treatment.
So those groups will be given priority attention so that we can go ahead of the virus as quickly as possible.
Okay. And when you talked about vulnerable groups, you didn't mention pregnant women and a certain group of children.
Yes.
So there's a special dispensation for them.
The only reason is that the vaccine that we have now, in terms of the safety trials, we've not used it on children. We've not used them on pregnant women. There are studies going on to see how do they react to it. And so as enough information comes out, they'll be added. They are not being taken out because we have a definite problem with them. But the current vaccines around has not been tried on them. And so we cannot be sure. Safety is extremely important for us, especially pregnant women and children under 16. So once we have the new information, we'll change.
Very well. What are the cost implications involved in this vaccine for not just the state, but also at the individual level?
Well, at the individual level, depending on the type of cost you're talking about.
Are we going to pay for it?
Oh, no. I don't.
We're not going to pay.
I mean, vaccination in Ghana has always been free.
So this
apart from probably you have to move to the place to get it done.
Which is at your own expense. Okay. But on the state's side, how much are we looking at?
There are two cost drivers. The first one is the cost of the vaccine itself. And then the cold chain about it and how the vaccine itself is one. And the cost will depend on the mix you have. We have vaccine that prices ranges from $3 to $25 to $40. So it depends on the mix you have. And because of the global shortage, one cannot say, I'm only relying on one vaccine. You may not get enough. And so you need to have them. And so that is going to dictate the price. But we are looking at averagely about $7 or so. That is just an average thinking, but that doesn't really tell you that this is what you're going to get. If you are getting Pfizer, if you are getting Bio, the prices are different. Okay, so even if you use the COVAX, there's a WHO Gavi group that is giving 92 countries who are in the lower economic brackets, about 20% of their population are going to get it for free. So once that comes out, that'll be free. Then you're going to have about 14 or so million people who we will have to buy for. That is in the first phase. And so if you look at that and you look at the average number, and you'll be able to tell. But also there's a cost of delivery, the operational cost of training people, buying cold boxes, people moving from one village to another, few support for people who are going to give the services, cold chain. We need to buy additional fridges. We may need to buy what we call the ultra-negative fridges for some of the newer vaccines that are coming. Our vaccines have always been between 2 and 8 degrees. Some of the new ones will have to be stored at minus 70 degrees. Some have to be minus 25 degrees. We need to build capacity for that. So that is what the next cost driver is. That is the operational cost of the vaccination. Okay.
So I take it that we are not limited to the AstraZeneca.
No. You can. Nobody, no country is doing that.
That's impossible. I wanted to ask you then, given what influence or how much influence does the COVAX facility have to ensure that, supposed poorer or lower income countries are not, bullied out of the clamor for the vaccines?
Well, I think they have secured some 20% for you. It's up to the country to also go out there and get the rest of the vaccines. And so that's what it is.
And a question...
But there are global efforts to ensure that there's some equity and that the poorer countries are not shelved in a way. So there are systems in place that ensure that we also get vaccines. And the government is making significant effort to get other vaccines beyond the COVAX.
Okay. Let's talk about importing the vaccines. Is this going to be solely a responsibility by the government, or private people are allowed in it, and how, if so?
Well, that's a very important question. You see, vaccines are very, very delicate things. And even under the current system, no company will sell to a private person. They can only sell to a government.
Okay.
Vaccines, you see, if you are not vaccinated properly, someone else is at risk. And so the importation and bringing it in is state. And we are using emergency use authorization. And that dictates that can only be done by the state, to bring it in. Now, we are also going to be the one to deploy. Even if for some reason systems has changed and you buy your vaccines, you still have to ensure that we keep the cold chain and we vaccinate you. So you are not going to leave it for people to keep and vaccinate and sell. Okay? So that is very, very important that it comes out.
And we also understand that every individual will have to take 2 doses.
It depends on what you are taking. A large number of them now are 2 doses. We have Johnson & Johnson, which is on the way. Maybe after June, we may have it. That's a single dose.
Okay.
The Russian Sputnik is also working on a single dose vaccine, even though they have a 2 dose. So it will depend.
Okay.
But you are not going to have Sputnik and have AstraZeneca first. If you have AstraZeneca first, the second dose has to be AstraZeneca. We don't have any evidence that you can mix them.
And I'm going to ask who can take it, but not in the sense of the categories of people. But for instance, if I have recovered from COVID, can I still take the vaccine?
Yes.
Okay.
Because what the evidence is that if you have 1 dose, it gives you enough protection, but probably not enough evidence. And so everybody is going to have the 2 doses to ensure that, stronger immunity is not bad.
Okay. I have to indicate that...
but one may probably not, you may not, if you have to queue, you may not want to go for the people who have recovered from.
Okay.
They can wait a bit.
Okay. I would want you to touch on the vaccination and the new variants, but I just want to indicate that we've gone past 10 o'clock, and this is so because of how packed our show is today. We plan to do it this way, and so if you've noticed, it's about 8 minutes past 10, and we are still here. So still join us and learn something. Doc, let's talk about the vaccines and the new variants. In the wake of the new variants, a question someone will ask is that, well, these vaccines, work on them began when COVID broke out. So now that there are new variants, what does it mean for the new variants?
Well, thank you very much.
For the vaccine, I mean.
As a country, we've been checking on the genome sequencing to see whether there's any new variant comes up. During the vaccination, we're going to continue it as more of a surveillance to see. Currently, the UK variant is the dominant variant in Ghana, and the current vaccines we have here are all suitable for that. Even for the South African variant, it's still the Strategic Advisory Group for experts from WHO say that's still good enough to prevent you from severe disease. It is not that it doesn't work at all. It may not give you the same protection like it does for the other variants, and so it's still very good enough. And so we'll continue learning and studying. I'm sure the vaccine producers are also going to learn, and they continue tweaking their vaccine to look at to respond. If you are aware of the flu vaccine, almost every year there's a change because they continue studying the virus behavior and then also make the most appropriate vaccine that will deal with it. And I believe that the same will happen with the variants. Okay.
I want us now to talk about public education or creating awareness. And I'm sure Neil would want to chip in on this at some point. But if you would remember, there was some apprehension towards the trial vaccines this was when Ebola broke out. And Ghanaians rejected the whole idea. Lots of people didn't want to be part of that. There are 2 different instances, yes, but it still comes back to the apprehension that was created around vaccination. What's your plan to get people to be open to it, understand what it is, that it's going to protect them, it's going to help boost their immune system, it's not going to give them any strange illness? What's the plan to address that?
Well, we have a very comprehensive communication strategy. Yesterday was the first outdoor, and we tried to let people know. A lot of this vaccine hesitancy is born out of ignorance. Of course, sometimes there are some practices that happened many years ago which people still hold on to it because of the way some blacks were used for vaccines that we're not too sure about. But what we're doing is we're doing a lot of public education. We're going to do NCC, Ministry of Information, the Ghana Health Service, and the other partners are in the group to look at that. Our regions are doing community engagement. We're getting our chiefs, influencers. We're doing a lot of multimedia campaign, etc. Yesterday, Dr. Yao Bediako showed people that we started vaccination way back in 1700.
A long time ago, long time ago.
1700. And you see what vaccination has done in Ghana. I believe that with time people understand, because we have about 96% of our kids who are vaccinated, and they are carried over there by their parents. And I believe that since nothing is going on, we will have that. But we're going to use that as a tool. We are going to also explain to people. We are going to get out all the side effects that people are expected to get when you take the vaccine. When you take a vaccine, it's like taking medication. You should expect some reaction. I'll be very worried if I take a vaccine and I don't feel anything. It may mean that I may not have even...
So we should expect the side effects?
Yes, you should expect. If you take your child for deep penta, you get a low temperature. That shows that the immune system that you talked about is responding. And if respond, you should feel something. You see, there's a difference between getting vaccinated and getting immunized.
Okay.
Vaccination is the injection you get. Immunized is the fact that you have responded and now you are protected.
That's interesting.
And that response, there should be some minor burning pain, there'll be a little temperature, etc. But I'm sure that is better than getting a COVID and dying.
It's because of the notion that you're going to the hospital or you're going to see somebody to make you feel better, and then you see something else happening on that.
That's part of our communication that we have to tell people that when you take the vaccination, you are taking it to protect yourself from getting the disease.
True.
But the cost of it is that you may have a little temperature, you may have a few heat here, a few pains there, and that should be expected.